Thank you, Ray.
Okay.
Awesome. Pleasure to be here at Ray headquarters. My name is Sam Diaz. I'm a dental prosthesist from Australia. I've been in the industry since I was 13 years old. I'm crazy about dental dentistry and digital dentistry. I run and own several dental practices, and I work for a lot of practices around Australia. I'm very busy, very active. And it's my passion. Rayface, ever since I introduced Rayface into my practice, it's sort of helped me better communication with my patients, explaining what the outcome is going to be like and what they're going to receive at the end of it. Because as much as we like to sort of use general terminology with patients, patients don't know dental terminology or what's going to happen with certain setups and certain concepts of occlusion or labial profiles and all this kind of stuff that we take for granted. You can actually show the patient and they'll become more understanding, and you can break that barrier of communication. The fact that they can actually see their teeth before they get their teeth and have that open dialogue with, no, I like it a little bit bigger or smaller, or the different arranging of teeth and alignment and arrangements, that's been a big game changer, as well as the fact that they can actually see something way before we do it and get explained the reasons why we're doing it. I'm a big person of that. It becomes more of how the work should be, not it's an excuse after the fact of why a certain way everything's set up. So yes, it's a big changer because the patients can actually see what they're going to get before they get it and get well informed of what's going to happen before they get it as well. It's increased it, but it's decreased it a lot in the final outcome, because as a dental prosthesist myself, generally we see patients with several amount of appointments with try-ins and retries and adjustments and all this kind of stuff. Moving into digital dentistry, it's sort of minimized the amount of appointments. So yes, it's increased my first initial appointment, but it's decreased the longer appointments and the back and forth and the miscommunication and the frustrations. So yes, overall it's speeded everything up. It's basically having, as I said, not to repeat myself, but it's basically having that replication of the patient into your lab, because we're all dental professionals. We work quite many hours. We see a lot of patients at the end of the day. Having that reference at the end of the day when you're sitting down and designing your dentures and you're designing your mouth rehabs or your veneers or crowns, having that patient's face back there, and you'll be able to remember everything that you've had, that conversation with the patient, the little pitfalls, the midline shifts that you didn't note down, all these kind of stuff and things that you can improve by having a digital patient with you right there. So yes, it's improved quite a fair bit.